Okay, girl, come here. Let's make this make sense. Today we're talking about congestive heart failure. And if CHF has ever confused you, I want you to forget about all the complicated terminology for a minute. Think of your heart as a pump. Your heart's job is to take blood and pump it forward throughout the body. When the pump can't keep up with what the body needs, we call that heart failure. Now here's where I want you to understand something. Heart failure does not mean that the heart has completely stopped working. The heart's still beating. The problem is that it can't pump effectively enough to keep up what the body needs, and pressures start building up. When blood isn't moving forward efficiently, it starts backing up. That's the key to understanding congestive heart failure. Remember that. Now let me show you why this matters. Left-sided heart failure. Think about where blood backs up when the left side of the heart's struggling. Behind the left side are the lungs. So if blood starts backing up towards the lungs, fluid can build up there. And what is your patient going to tell you? I can't breathe. They may be short of breath. They may have crackles. Their oxygen saturation may be decreased. They may have a cough. They may tell you, I can't sleep lying flat at night. I need to sleep in my recliner, or I have to have 3 pillows propped up behind me. This is called orthopnea. Or they may tell you, I fall asleep and I wake up gasping for air. So when you're trying to remember left-sided heart failure, I want you to remember left equals lungs. Left side fails, blood backs up towards the lungs, the patient gets pulmonary congestion, which in turn makes it difficult for them to breathe. Now let's discuss the right side. Right-sided heart failure. If the right side isn't moving blood forward effectively, where does that blood back up? Into the body. So now we're looking for systemic venous congestion. You may see swollen legs and ankles in your patient, peripheral edema, weight gain from fluid, jugular venous distension, or also known as JVD, sometimes abdominal swelling or ascites. So remember, right equals the rest of the body. Left backs up into the lungs, right backs up into the body. That's your foundation. Now let's say your CHF patient arrives to the hospital short of breath with bilateral lower or both legs swollen. What are we watching? First, we're watching for breathing. How does the patient look? Are they working hard to breathe? What is their respiratory rate? What is their saturation, their oxygen saturation? What do their lungs sound like? Do you hear crackles? Have they gained weight? Do they have a history of heart failure? What medications are they taking? If we hear crackles, this is suggesting pulmonary congestion. Now let's look at fluid status. Look at their legs. You see the edema? How much? Is their abdomen distended? Do they have JVD? What is their weight? And this is why daily weights are so important in our heart failure patients, because fluid has weight. So if your patient gains several pounds very quickly, we know this is not fat. Fluid